Well, hello. My name is Joseph Jordan, and I am the CEO of the North Carolina Professionals Health Program. And what I would like to do today is present to you an opportunity to perhaps have some understanding and some knowledge about recognizing substance abuse in your workforce. So I'm going to talk a lot about the use of substances. I'll use terms like chemical dependency, substance use disorder, alcoholism, addiction. What I'm talking about is the use of substances such as marijuana, cocaine, alcohol, opioids, other painkillers for people that use those in a way not prescribed for them. And that substance abuse will present in your workforce on occasion, and as a result could potentially affect your ability to provide good care and their ability to provide good care, because if you rely on the people in your workforce, as we all do, if they're abusing substances, you need to be able to recognize it and know what to do. So first things first, I'd like to say thank you to the North Carolina Veterinary Medical Board, the North Carolina Veterinary Medical Association, because they make the North Carolina Veterinary Health Program possible. And it is their ongoing support that allows this program and this presentation to occur. So I just want to give a shout out to those two organizations. And also, this is my yellow lab, Tanner, and I would like to say thank you from him. He is cared for by some wonderful veterinarians at the Rollsville Veterinary Hospital, and the technicians and veterinarians there do a wonderful job, and so I'd like to say thank you to them while I'm doing this presentation. So, on with the presentation. Now, the first thing I'd like to talk about is you have probably heard about the prescription opioid epidemic. And I have up on the screen here a information about, do veterinarians have a dog in the fight? Now, all puns aside, one would have to wonder whether the fact that veterinarians who prescribe opioids in the course of their practice, do they have any role in our current opioid epidemic? And for 2016, there were 42,000 deaths and over 1,000 emergency room visits daily. So that means every day in America, there were 1,000 ER visits in regards to opioid overdoses or opioid treatment. That's a lot of money, a lot of time, and a lot of tragedy in regards to persons that are abusing opioids and end up in danger of possibly dying as a result. So one thing we do know for a fact is that veterinarians prescribe synthetic opioids, such as, well, in fact, one of the stories that I've heard recently is that people are beginning to run across carfentanil, which is a potent um, uh, preparation of fentanyl used to tranquilize elephants. So potent that it can end up killing someone very quickly, and there's not a lot that can be done about it. And the only people who prescribe that particular medication are veterinarians. So there are other synthetic opioids prescribed by veterinarians, but that's one in particular that is of significant concern. So the authors of this American Journal of Public Health thought, well, if we want to know if veterinarians have a role in this, we need to get a bunch of veterinarians together. And so they convened a focus group of veterinarians. Focus group means they got together a group of people in a particular area of expertise. That's what a focus group is, and they literally focus in on one particular issue. And so once they got this group together, they did a 24-item online survey. Just to get their perspective. That's what you do with a focus group. You know, people use focus groups for product development, such as cars or other things. You know, how does this car look to you? Do you like the color? Do you like the wheels? Do you like the tires? This was a focus group to get people's perceptions of abuse and misuse of opioids by animal owners. So I'm back for this slide, and what I would say is that when they did do this focus group and they surveyed 189 Colorado veterinarians, this is what they looked like. This is what the focus group was comprised of. 64% female, over 3/4 were 40 years of age or older, and the actual time in practice average was about 22 years. Half in a suburban setting, and almost 3/4 were practicing small animal care. I would guess that this represents Colorado pretty well. I think here in North Carolina, probably there's more in suburban and urban settings than in this particular focus group. Now, what is really concerning about this survey is the information I'm about to share with you, and that is that 13%, which means about 20 to 25 of these surveyed vets were aware that an animal owner had intentionally made an animal ill, injured an animal, or made an animal seem ill or injured in order to obtain opioid medications. So this is a situation that a pet owner abused, there's no other word for it, abused their pet in order to obtain medications. Now, there is a story out there, you can find it on the internet, that really points to the level of desperation that people with opioid addiction can experience. And a woman that used a razor to cut her golden retriever at least 2 times, maybe 3, in order to obtain pain medications for the dog, and was eventually found out and prosecuted, which I'm personally amazed by, but at the same time I understand. As someone that has worked in the field of substance use disorders for a bit of time, I have heard stories about people cutting themselves or injuring themselves to get medications. So it's not particularly surprising to me that someone would injure an animal, even an animal they love, in order to obtain the medications that they are craving. Addiction is a horrible illness. It affects people's ability to think clearly and rationally. And so I could understand in a way how someone might be driven to do this. Now, in addition, in this survey of about 190 vets, 44%, so that's going to be right around 80, were aware of opioid abuse or misuse by either a client or a veterinary practice staff member. So, and within that 44%, 12% were aware that it was a veterinary staff that did opioid abuse or diversion. So now sometimes people, and this is one of the things to think about when you're thinking about your staff, sometimes people will divert medications in order to sell them or in order to use for themselves, but also to use for a family member or to get for a family member. Not everybody that diverts medications is using those medications. So there are times in which there will be missing medication stock, but what that will reflect is somebody that is obtaining those medications to either sell them or to give to a family member or friend or loved one. So, what did this survey find? Now that we have talked a little bit about who was in the survey and what their belief was around opioid abuse and misuse. So, over half, 62% actually felt that they had a role in preventing opioid abuse and misuse. But really interestingly, only 40%, or actually 40%, were unsure if opioid abuse or misuse was a problem in their community, which is a little odd that over 60% felt they had a role in preventing opioid abuse or misuse, but 40% were unsure if it was a problem in their immediate area. I would guess that these are individuals that, for one reason or another, are not wanting to admit there's a problem. Denial is a powerful thing, and certainly could lead to people being unwilling to admit that opioid abuse and misuse is a problem right around them. I think it would be very difficult for someone to reasonably, I'm going to adjust the camera here, to reasonably say that there's not an opioid problem in their immediate vicinity these days. Now, what led, I think, to people thinking about offering trainings like the ones that you're watching and engaging in is that 3/4 of the participants in this survey said their veterinary medical school training on opioid abuse or misuse was either fair, which means it was okay, poor, which means it was pretty bad, or absent completely. So it'd be interesting to break that 73% down and see, well, was it completely absent? You know, was that, of that 73%, was that half of them where they didn't have any at all? But that did not happen. But we know at least 3/4 of them said, look, it was either okay, pretty bad, or none at all. And remember, these are people that have been in practice an average of 22 years. 64% of them said they had not completed any continuing education on best practices for prescribing opioids since entering practice. Now, part of the reason that I think veterinarians are being looked at or asked about this issue or educated about this issue is diversion of opioids from legitimate prescriptions is one of the primary means whereby people obtain opioids illegally. So to break that down, one of the primary ways that people get drugs on the street is when they get those drugs from somebody that has a valid prescription for them. So because we know that veterinarians write prescriptions every day for medications, and that a certain percentage of those are going to be for painkiller medications because people take their dogs or cats or other animals to the vet when they're injured, it's reasonable to assume that there's going to be prescribed painkillers, some of which are going to be opioid type. In fact, I'd say a large amount are, and those can be diverted. So it seems to me there should be some continuing education on best practices for that, given the opioid epidemic we have going on. But 64% of the vets in this survey said they had no continuing education. And when they were asked about that continuing education, what were the priorities? Over 80%, specifically 81%, said we need to know about opioid abuse prevention. 55% said we need some pain management guidelines. We need to know how to manage the pain of animals in a way that we're not going to be likely to have those medications diverted by clients. And about the same amount, 54% said, hey, how do we engage these electronic resources to help prevent opioid abuse and misuse? And when we say electronic resources, what we're referencing is a prescription drug monitoring program. Almost every state in the union at this point has a program, a computer program that is maintained by the state that monitors and keeps track of medications of a controlled nature that are written in that state. And that's called a prescription drug monitoring program. And you can see here on this last bullet point where it talks about a PDMP. That's what it's talking about. And they said more than a third, 36%, said they needed help and asked that they get improved guidelines and improved tutorials to help them access the electronic resources that they have available to them, that 54% that said that was an educational priority. So now we'll move on to the next slide. So there were three main recommendations that the authors of this article shared. One was that there be increased tracking and surveillance for our opioid medications. And this would be done through two means: through a state prescription monitoring system, similar to the one that is now used in North Carolina, called the North Carolina Controlled Substance Reporting Database, and that there be enhanced workplace policies. Now I'm going to go a little tangential here from this slide and let you know that the North Carolina Professionals Health Program has a workplace policy boilerplate that I'm able to share with those who would like to use it. It's fairly extensive. It has letters that go out to people. It has policies and procedures. It's done in Word, so you could utilize this workplace policy for a drug-free workplace at your leisure. Just two things. One, I would highly suggest that if you do ask me for this workplace policy and I share it with you, and I'll put this in any email that I send out to someone, that you consult with an employment attorney and that you make sure and apply that workplace policy fairly and across every employee. Policies are only as good as the people that enforce them. And so if you do decide to enhance your workplace policy, consult with an attorney and also consult with a substance use disorder professional. And if you're in the state of North Carolina, or maybe even in other states, you can contact me and I will be happy to provide you the name of someone that could potentially assist you in this process. Now, there was the second recommendation was for increased awareness and education among veterinarians in regards to the opioid prescribing and also how to recognize and intervene, which is what I hope you will get from the second part of this presentation, where we start talking about signs and symptoms of substance use disorders in a variety of different areas. And then lastly, of the three main recommendations, research. And what they meant by this was having a systems analysis to examine and track opioid prescribing. And I believe that is within a practice. So as a veterinary practice, you would track who is writing controlled substance medications or opioid medications and examine that. See if there's someone that's writing more, see if there's ways that those conditions can be treated by non-opioid measures. And then finally, have a way to identify and evaluate best practices for veterinarians in regards to prescribing and pain management. These were things that were discussed in an earlier slide. So on to the next slide now. So what I would like to do now is give you some vignettes, some situations where you might recognize substance abuse in your workforce that before this training or before this PowerPoint you may not have recognized. Now the vignettes that I'm going to read to you, there's two of them, and this first one and the second one actually both are based on actual events, but they've been changed some. So in the first vignette, as you can read on the PowerPoint slide here, is one in which you come into work one day and someone has left the controlled substance cabinet unlocked, and you check where you keep the key, and it is locked in the closet, and the key is in the same place that it normally is. And then you start checking the controlled substance log, which if you don't use one of those, I would highly suggest you do so. In fact, I think you're required to. But you notice one of the newer techs that has just started working for you has more entries than anyone else. And now this tech is well liked by everyone. It's always willing to help out, will come in on days off, volunteers to help out on surgical cases at the drop of a hat. And what you see is that she worked late last night. And when you ask to see if she's coming in that day, you find out that she's called in sick. So then when you go to check the cabinet, everything seems okay, but you notice that the morphine sulfate's been moved, amount looks fine, and you notice that the count is off for a variety of medications, but only by 1 or 2. And upon closer inspection, you notice a small hole in the vial of morphine. And the question here is, what would you do if this happened? Now, I'm not asking for you to tell me what you're going to do or write anything down, but just think about what would you do in a situation like that. And so now on slide 2, and this is another vignette. Let's say you're a partner in a large practice with multiple veterinarians. You've rotated in as practice president, you've had a drug representative dinner, and after the dinner, one of the techs comes to you concerned because one of the other veterinarians was very inappropriate with him and then drove home when it was clear that she was intoxicated and impaired. So you go speak with the veterinarian. She's highly insulted, claims the tech was actually inappropriate with her. And then when you go to talk with one of your partners, she makes the comment that this is probably not the first time, just the first time that someone has said something. And if you're in that situation, what I want you to think about is, how do you address that? Because clearly someone's been abusing substances as a company, at a company event, and was driving while impaired, and allegedly was quite inappropriate with one of your workers. So, in thinking about those vignettes, we're now going to talk about some of the signs and symptoms of addiction that you may come across. And when I'm doing this presentation in real time, I'll talk about the fact that these signs and symptoms in the beginning they're kind of a large, big thing out here. I'm spreading my hands out to say that they encompass a wide range. And then what happens is, as someone's life becomes more and more about addiction, it becomes a smaller and smaller life, and less things do they have in that life that they can get affected. And you'll see that as we go along. So the first thing, or one of the things that you see when people have substance abuse disorders, is they start to withdraw from their community. The drugs and alcohol begin to take a primary role in their life, and as a result, they don't have the time, they don't have the effort, they don't have the resources, whether it's emotional or psychological or physical resources, to interact with peers and coworkers and friends. They become unpredictable. And the reason I underlined unreliable and unpredictable is that at community and social activities, you never quite know whether this person is going to show up or if they're going to come. They come late, they leave early. They just don't interact with people like they used to. And during this time, one of the things you may see is they will get a DWI or have other legal problems related to their behavior when they're under the influence. And so what you will see is unpredictable behavior. Next slide is employment. And these are things that you will see in their employment history or when they come in to interview with you for a job. Their employment history will show numerous job changes or unexplained geographic relocations. We call that the geographic cure. This is the dynamic in which people think that if they move or if they go someplace else, they will not experience the same problems that they did at a previous place. And then you'll see unexplained intervals between jobs. That can be due to being in treatment, or that can be because the person goes on an extended binge. You will see indefinite or inappropriate references where someone is overqualified for a job. You may also see a reluctance to do a pre-employment physical exam or to have the family members with them or involved in the process. All of these things should give you a warning sign. And one thing I do want to say, and this has to do with all of these symptoms, if you just see one symptom, that doesn't mean the person has a substance use disorder or an addiction problem or whatever we want to refer to it by. Please don't overinterpret these signs and symptoms. You could have these as a result of being depressed. You could have these issues as a result of having an extremely stressful event in your life. But if you see enough of these, there's something going on. And one thought you may want to have or should have is this a sign and symptom of a substance use disorder? And anytime someone doesn't want to do a pre-employment physical exam and resultant urine drug screen, that should be a big red flag. Now, the effects on the family. Unfortunately, with substance use disorders, you will see that the family experiences negative effects, much in the same way that the person with the disease experiences negative effects. So they will begin to withdraw from family activities. Remember, I said that their life may be out like this, and then what happens is it gets smaller and smaller and smaller. I'm trying to get this in the video. And here, they've gone from having time for their family to not having time for their family. So you'll start to see unexplained absences. There'll be fights. There may even be child abuse. We do know that in 80 to 90% of domestic violence situations, alcohol or other drugs are involved. There's inappropriate care taken by the spouse as they attempt to justify or rationalize or lie to people about their spouse's behavior, often out of shame or guilt or thinking that it's something they did. You'll see abnormal, antisocial, or illegal behavior by the children because children respond to the dysfunction of their family. That is, children are like barometers. If the pressure is going up, they respond. And there's just no way they can't. And then, unfortunately, as a result of drugs and alcohol, you will often see separation and divorce or affairs that then lead to separation and divorce because the family is responding to the disease of the person with the addictive disorder or substance use disorder. Next slide. Now, as I said, the person is really starting to have some pretty serious effects from their use of substances. You'll see a deterioration in physical condition. They begin to have frequent visits to physicians, dentists. They will have actual accidents in which they get injured. You may see a deterioration in the way they present at work, in their clothing or personal hygiene. You'll start to see multiple physical complaints from this person, or also you'll see emotional crises where they'll call in and say, I just can't come to work today, or I've got something going on that with a family member. There'll start to be a pattern. And then in the office. And the reason I put this at the end is because people that work in safety sensitive positions, such as physicians, veterinary technicians, veterinarians, pharmacists, those are called safety sensitive positions. What I have found is that often the last thing that goes will be their work site, their work behavior. And then when you begin to see that their substance use is affecting their ability to work, then you will really see that their disease or disorder has progressed. And so you'll start to see hostile and unreasonable behavior to office staff and clients. You'll see complaints from clients about their behavior. I've had referrals from veterinary practices where clients were calling in because the animals had been there 2 or 3 times for the same issue, and the veterinarian that was taking care of them could just not do it. Unfortunately, you may actually see some impatience or abuse of animals, abnormal sedation. And when I say abnormal, that means, excuse me, it could be too much sedation because they're using too much of the drug and not paying attention, or not enough. So animals will start coming out of anesthesia or out of sedation earlier than you would expect, and that's because the person is diverting medications that would be used for the animal. You'll see an undue attention to controlled substances. The person will pay particular attention to medications. They may even volunteer to help out on the reconciliation of medications in order to be in a position where they can divert more easily. You will start to see absence from the office that is unexplained, or frequent illnesses, which we will call absenteus mundaeus or fridaeus earlius. It's a little bit of humor into it, but it's a serious thing, as you'll start to see the person just unable to make it into the workplace or trying to leave early. And then, which is somewhat contradictory, is you'll see people coming in on their days off. And the reason they do that is because it's a time in which everybody else is scheduled to work, so they'll be busy doing the tasks of the workplace, and this person will have the ability to be there, but to go wherever they want. And this is a time that they will often try to divert medications because everybody else is busy and they're able to time it when they want to. And then finally, as we start to get down to the very end, we start to see these obvious signs: alcohol in the breath, gait problems, slurred speech, and then even track marks, which are the bruises that are left on people's arms or legs or other parts of their body when they shoot up medication. And by shoot up, I mean IV use or IM use. When you see any of these, it's time to step in immediately, get the person off of their work schedule, take them off the schedule, excuse them to go home. The other thing that I do want to say is slurred speech and gait problems can be signs of other medical conditions. So if you see those particularly, the person needs to be medically checked out. Don't allow them to drive, certainly with any of those, or alcohol in their breath. Get them checked out. Have someone take them to the hospital, to the emergency room, or somewhere else where they can be evaluated by a medical professional. So what we say here is that the person may have a SAR syndrome, and this is a mnemonic device for something ain't right. That's correct. SAR, something ain't right. And with that syndrome, that means you know something is going on with this person. You are aware that they are not functioning well. You've known them from before, and now you're seeing some changes, and you can't really pinpoint what the source of those changes are. It's not immediately apparent or discernible to you, um, and you will find yourself wondering, why are they acting like this? And so I'm hoping that by seeing these other symptoms, those changes will be recognizable to you as a potential substance use disorder. It could also be a mental health issue, but either one of those we can help with at the North Carolina Professionals Health Program, or help you get help for them. So here's some general principles about substance use disorders that I'd like to talk about sick versus impaired. I'm going to show you a chart that has some signs and symptoms of addiction issues on it. I'm also going to talk about random drug screens and how to do those. And then what do you do with a negative or a positive? So some general principles about substance use disorders on this slide. Number one, the person is sick with an illness. It is also termed a disease. It's been called that for decades now, and certainly needs to be treated as a chronic disease or illness. And just because the person's sick does not mean that they are impaired. Much like someone can be sick with diabetes, which is a chronic illness as well, but they may not necessarily be impaired by that illness if it's well controlled or well in remission. Cancer is another illness. You don't ever get rid of it, but you can put it into remission. The other thing about having this illness is it doesn't mean the person is bad. This is not a moral failing. It means the person has an illness, and that illness is affecting their ability to function, potentially affecting their ability to function in the workplace. Doesn't mean they're bad, means they're ill. Now, the issue that I would like to say is that this bad behavior, which is the behavior associated with being sick, can and often does lead to consequences. And so early on in the illness, you will see that the way we conceptualize it is that the impairment has really not grown that much. The person can be quite ill, but they're able to function, they're able to go to work, they're able to perform the duties of their work. They're still keeping it together, so to speak, or holding it together. As the illness progresses, the impairment becomes paramount, and you begin to see more and more of it. And this is with any chronic illness. For example, I'll use the one of diabetes. Is uh, People in early diabetic conditions often, although the illness is there, it doesn't affect their ability to work. It doesn't affect their ability to do anything. But if they don't treat it and keep it monitored and keep it under control, then that impairment grows and grows to the point where they may need to be even hospitalized. And that is what we see with late stage illness of addiction or substance use disorders is as people get farther and farther along in the illness, they're much more likely to be impaired in a variety of ways and will need more care and even hospitalization. Where your board, the veterinary medical board, the human medical board, or the pharmacy board comes into play is when this illness has resulted in impairment, and this impairment in thinking and understanding, which then can result in unprofessional conduct. For example, driving while impaired. Someone could have the illness of substance use disorder. They begin not addressing that. As a result, they end up drinking and driving when they're impaired. They get charged for that, and that is the unprofessional conduct. And of course, the board has to step in at that moment. What I'm showing you here is a Jellinek chart. And the reason this was developed, obviously, by Dr. Jellinek. And this is a picture that provides some touch points for people in regards to what happens when someone starts developing a problem with substances, and then what happens when they start rehabilitating or healing from that process. So you'll see over here things like onset of memory blackouts, wanting to take the first drink, not able to talk about their problem. They may try geographical escape. Remember, I mentioned that earlier as a symptom that people will try to, that you'll see that in their employment issues, that they have moved often or moved for no real good reason. So what this chart does is give people something they can look at and say, oh, I did that, or I did that, or I did that. And then it gives them things to look for as a result of getting into recovery. For example, an honest desire for help is necessary in the very beginning. People learn that alcoholism or addiction is an illness and that it can be arrested, that addiction can be stopped. And they get some hope, and they may start group therapy. They start to eat and sleep on a regular basis. So all of these things start to happen as the person begins the recovery process and moves along that recovery process. Now, if they start drinking, they'll end up right back over here. And this is why we have the belief in the treatment community that you should not ever start. Once you learn that you have a alcohol use disorder, you should not drink again. You should avoid that at all costs. So we're going to talk a little bit about urine drug screens, because this is about substance abuse in the workforce. And the most common way in which substance use is determined or found out in the workforce is through the use of a urine drug screen. And if you do Google this, I don't suggest you do this at work or at home, but if you do decide to Google this, make sure you tell people why you are typing in how to pass a drug test. As you can imagine, that might create some concerns if people saw that in your search terms. So about 212 million results will jump up on that search that you do in about 0.66 seconds. That should tell you just how many people are trying to get past, pun intended, a urine drug screen. So some rules or some ideas or some suggestions around urine drug screens. Number one, they need to apply to everyone. Everyone should be in the workforce, from the doctor down to the newest technician, should be subject to random urine drug screens at any time. And it has to be enforced fairly and evenly. You cannot single people out just because you think they may have an issue and then not screen other people because you don't think they do. If you're going to do a random urine drug screening protocol, it needs to be fair, even, applied to everyone, and random. So that's for just a general urine drug screening program that you do because these are people in safety sensitive positions, and these are people that have access to controlled substances. Also, you have urine drug screens that should be done for cause. So if someone has an accident at work, this is one sure way to make sure that they weren't impaired. If you have missing medication from a shift, you should test everyone that's on that shift. I've taught with several practices that if they have a substantial missing stock, they will test everyone that has been around that stock or has been on the work on that shift. or if you think someone's impaired in the workplace. And as I said, there's lots of reasons that people may present as being potentially impaired. Your job is to help them prove if they tell you, no, I'm not impaired or I haven't been doing anything. A urine drug screen can really show that. And you don't have to take their word for it. You can get objective data. Now, should you wish to do so, you could go on YouTube and look at these videos. You should be able to click on this from your computer. And if you do, you will see in this first one, gentleman that came up with a sort of a homemade way to avoid a urine drug screen. And then if you click on this next one, you'll find a very technologically advanced way to avoid a drug screen. So that's why I say it should be observed and it must be repeatable. So if you have a situation in which you think someone has somehow been avoiding providing an appropriate sample, excuse me, you need to come up with a way for that person to be observed when they're doing a drug screen. This is very common, much more common than people may think. Certainly very common within the military, very common within police forces or probation situations. And please use a reputable lab to do the urine drug screenings. There are dipsticks out there that you can buy at Walgreens or other fine retailers around the country, but a dipstick has an unacceptable level of false positive and false negative. So I would highly encourage you to use a reputable lab. Drug screens can generally be done for around $30, which is certainly worth the investment if it keeps you from having someone in the workplace that is impaired. So we think there may be a problem here, and we're not sure what to do about that problem. What do you do now? That actually is a different presentation. This one is about recognizing substance abuse. The other presentation that I do for the Veterinary Medical Board upon request, and we'll be looking at potentially putting up on the website, has to do with intervening. But for right now, in order to get your credit for this video, you need to answer all these questions. And what you need to do is write this on the form that's listed on our website. So if you go back to www.ncphp.org, you will see that in the veterinary and veterinary technician section, if you look where you found this video, there'll be a downloadable form that you can use and fill out these 5 questions. So the first question, I'm going to read the questions to you and then go through the answers. So, and understand this activity that you just did is good for 1 hour of CME. So make sure you record these answers on that sheet. If you want to, you can probably pause this and go and download that sheet. Or you can just grab a piece of paper and a pen, what's next to you, and write down the letter of the answer. So number 1, SAR, stands for A, stop, advise, report. B, something ain't right. C, supervise, advise, repeat. Or D, show, act, and respect. So among those 4 answers, SAR stands for which one? Number 2, a driving while impaired charge means A, the person was above the legal limit of alcohol allowed in their system when driving. I added a little bit there, but the person was above the legal limit for driving. B, about 1/3 of first offenders have a problem. C, about 2/3 of second offenders have a problem. D, all of the above. Or E, none of the above. And just so you know, I I will tell you that about a third of first offenders do have a problem with substances when they get a DWI charge, and C, about 2/3 of second offenders have a problem. I just want to make sure, the reason I'm giving y'all those two answers, and hopefully you know about A, is because a DWI is a very serious thing. So this is somewhat of a gimme. I'll let you figure out that if A and B and C are correct, which answer you should mark on this one. Three, what reason would you give a urine drug screen to an employee? A, just random chance, just part of a random program. B, there are some missing controlled substances in the workplace. C, they appear to be under the influence of something. Or D, all of the above. Number 4, one of the following is not a sign of office-based addiction. A, person's absent from work on Mondays and Fridays. B, being especially friendly to customers. C, paying undue attention to controlled substances and the controls. D, using larger than normal amounts of sedation medications. So which of these is not a sign of office-based addiction? A, B, C, or D? And then finally, number 5, all of the following are discussed signs, which means they have been talked about in this presentation. Discuss signs of employment-based addiction symptoms except A, being overqualified for a job. B, reluctance to do a pre-employment drug test. C, coming to work late on occasion. And D, numerous job changes. This one's a bit of a tricky, so think about, whether which of these are most likely to be signs of someone that has a substance use issue. And this is our NCPHP website. There's a section called Veterinarians and Veterinary Technicians that if you click on, you should see information related to those two jobs, occupational categories. Also, there's generally over here new information that you can look over as well. And then here is our contact information. So if you have any follow-up questions or concerns, having looked over this, if you think there may be something in your workplace that you're concerned about, or if you would like to have us come speak to you or your staff, certainly please use this information to contact us. Thank you.